Just so you know, Dr. Kochar, apparently you can't hear us, so the team here is trying to connect with you or your office. Or can you hear? Can you hear me?
Can hear you now.
Oh, perfect. Okay, wonderful. Thank you. Everyone can stand down. Welcome to meeting number 13 of the House of Commons Standing Committee on Public Accounts. Pursuant to Standing Order 108, the committee is meeting today on Report 15, Enforcement of Quarantine and COVID-19 Testing Orders, Public Health Agency of Canada. Today's meeting is taking place in a hybrid format pursuant to the House Order of November 25th, 2021. Members are attending in person, in the room, and remotely using the Zoom application. Compte tenu de la directive du Bureau.
In view of the Board of Internal Economy's directive of March 10th, 2022, all those attending the meeting in person must wear a mask, except for members of Parliament attending the meeting in person when seated in their seats. To ensure the smooth running of the meeting, I would like to pass on some instructions to witnesses and members. Before you speak, please wait for me to give you the floor. If you are participating by video conference, click on the microphone icon to activate your microphone. Please mute yourself when you are not speaking.
On Zoom, you have the choice at the bottom of your screen of either floor, English, or French. For those in the room, you can use the earpiece and select the desired channel. A reminder that all comments should be addressed to the chair. Pour les députés présents.
For the members present in the room, if you wish to speak, please raise your hand. For members on Zoom, please use the raise hand function. The clerk of the committee and I will do our best to keep the speaking order, and we thank you for your patience and understanding in this regard.
I'm informing the committee that all witnesses have completed the required connection test in advance of the meeting. I'd now like to welcome our witnesses. From the Office of the Auditor General, Karen Hogan, Auditor General of Canada, Carol McCullough, Principal from that office. From the Public Health Agency of Canada, Dr. Harpreet Kochar, who is the President, Bridget Diogo, Vice President, Health Security and Regional Operations Branch, Jennifer Litfala, Vice President, Border Measures Operations, Health Security and Regional Operations Branch. Witnesses will each have 5 minutes to make their opening statements. Ms. Hogan, you have the floor. Over to you for 5 minutes, please.
Mr. Chair, thank you for this opportunity to discuss our report on the enforcement of I'm sorry, there's a lot of echo. I don't know if you can, oh, perfect, it's gone. Mr. Chair, thank you for this opportunity to discuss our report on the enforcement of quarantine and COVID-19 testing orders by the Public Health Agency of Canada, which was tabled in the House of Commons on December 9th, 2021. I would like to acknowledge that this hearing is taking place on the traditional unceded territory of the Algonquin and Anishinaabe people. Joining me today is Carol McCullough, the principal who was responsible for the audit. This is our second audit of the border control measures that were used to limit the spread of COVID-19. This time, we found that the Public Health Agency of Canada had improved its ability to check whether travelers complied with mandatory quarantine orders. With the move to collecting travelers' contact information electronically in late 2020, the agency was better able to follow up to determine if travelers quarantined as required. Nonetheless, between January and June 2021, the agency was still unable to confirm whether 37% of travelers complied with quarantine requirements. While this is a decrease from the 66% reported in our previous audit, it is not a success story. 37% of travelers is still a large number of people to lose track of. In addition, the agency did not know what happened in most cases where individuals suspected of non-compliance were referred to law enforcement as a priority for follow-up. In any public health emergency, the agency needs quality information to know whether its approaches are effective and what adjustments may be needed to manage the situation. We also found that the Public Health Agency of Canada did not adequately administer two new border control measures introduced in early 2021 to respond to the risk of variants entering Canada. Incoming travelers were required to take a COVID-19 test on arrival, followed by a second test 8 days later. We found that the agency was either missing or unable to match 30% of test results to travelers between February and June 2021. Even more concerning, the agency never contacted more than 1,000 travelers who tested positive to inform them of their test results and related isolation requirements. La deuxième mesure de
The second additional border measure we examined was the requirement that travelers flying into Canada stay at a government-authorized hotel while waiting for the results of their COVID-19 test. At the time of our audit, the agency had records to verify hotel stays for only 25% of these travelers who flew in. Again, because of gaps and duplications in the way traveler information was collected, the agency was not efficiently administering quarantine requirements. In setting up the border measures, the agency conducted a gender-based analysis plus assessment that covered age, language, and digital literacy of travelers subject to quarantine orders. We found that only some of the recommendations from that analysis had been implemented. For example, anti-bias training for quarantine officers was not in place by the end of our audit. Overall, it was unclear how the agency used gender-based analysis plus analysis to mitigate potential negative impacts of quarantine measures on diverse groups. Finally, we found that the agency's ability to ticket people for not complying with quarantine orders varied across the provinces and territories. Almost all of the tickets were issued to travelers who refused to quarantine at a government-authorized hotel after they had landed at 2 of the 4 international airports that were open. Few or no tickets were issued to travelers arriving at the other 2 airports or in any of the other provinces or territories. At the end of our audit, the agency still did not have a plan to improve its enforcement capacity across the country. The Public Health Agency of Canada accepted our recommendations and has prepared an action plan to address them. Mr. Chair, this concludes my opening remarks. We would be pleased to answer the committee's questions. Thank you.
Canada. Dr. Kochar, you have the floor for 5 minutes, please.
Thank you, Mr. Chair. And thank you for the opportunity to talk about the work the Public Health Agency of Canada is undertaking in response to the audit of enforcement of quarantine and COVID-19 testing orders. Joining me today are Ms. Brigitte Diogo, who's Vice President, Health Security and Regional Operations Branch, and Ms. Jennifer Lutfala, who is the Vice President, Border Measure Operation, Health Security and Regional Operations Branch. Since the beginning of pandemic, Mr. Chair, the Public Health Agency of Canada has directed the implementation of border restrictions and border control measures to help prevent travelers from spreading the virus that causes COVID-19 in Canada. While our approach has evolved, our guidance and advice continues to be based on latest available science, epidemiology, and expert opinion. The agency, however, accepts both of the Office of Auditor General's recommendations as outlined in the audit report, and the work is already underway to address them. As you're aware, the Auditor General's audit covered the period of July 1st, 2020 to June 30th, 2021. Since that time, Public Health Agency of Canada has developed an action plan to address the audit recommendation. I'll take a minute to highlight the key components of the plan. The agency will continue to engage with provincial and territorial counterparts to ensure maximum collaboration when following up with travelers. In particular, we will continue to focus on those who tested positive. We're renewing our efforts to engage law enforcement partners, working to identify barriers to reporting and identify some interim and possible long-term solutions that will increase reporting on referral outcomes. For example, by providing an option for police to report if a visit is not completed. So public health agency can assess how many referrals have not been actioned, and by focusing law enforcement referrals on high and urgent priorities only. The agency is working with testing providers to develop innovative solutions to better reconcile traveler data provided to public health agency with test result data in the near term, while also developing requirements for an improved end-to-end system to enhance automated tracking and improve overall data quality. For example, to mitigate unmatched test results due to errors or inconsistencies in data submitted by travelers, Public Health Agency works closely with CBSA and testing providers to improve the completeness and quality of data fields used for matching. I must mention this, Mr. Chair, that within just over 4 months of the launch of Canada Border Testing Program in February of 2021, on-arrival and post-arrival test completion increased by 20% to 95% and 82% respectively. This was a direct result of efforts by the agency in conjunction with testing providers to address the barriers to test completion, such as reducing virtual appointment wait times and ensuring material will available in diverse set of languages. We're also looking at how we can improve and streamline methods for assessing data quality internally. We're also implementing GPA plus considerations to mitigate any potential adverse impacts that exist and in future programs have on diverse or vulnerable groups. Throughout the pandemic, Public Health Agency has developed and implemented mitigations to identify disparate impacts on border measures on vulnerable groups. For example, providing tailored accommodation where possible and making amendments to order in council to create exemptions for several cohorts of potentially vulnerable travelers. Finally, we are updating plans for administering and enforcing emergency orders in future outbreaks. This work will include incorporating lessons. Some of the work I just outlined has already begun, and some will begin as the pandemic winds down. As I mentioned, Public Health Agency of Canada agrees with both of the recommendations made in Auditor General's report. However, I would like to note that focusing only on select metrics, for example, record of stay for travelers who stayed at government-authorized hotel, the report's findings do not account for all the layers of compliance and enforcement program, how they work together. Together, these layers work to reduce the risk and limit the spread of COVID-19 travelers. L'agence continuera d'examiner.
The agency will continue to review findings and recommendations from this audit report. We will also review recommendations from other audits, evaluations, and lessons learned. This information will help inform our future planning so that the agency is in a better position to respond to any future global events. While Canada began a phased approach to easing border measures in July 2021 for fully vaccinated travelers, the agency took quick action at our borders in November 2021 to mitigate travel-related importation of the Omicron variant through enhanced testing and quarantine requirements, as well as travel restrictions. The situation at our borders is fluid, and we will continue to evolve our measures when and where necessary to protect the health and safety of all Canadians. Thank you.
Thank you very much, Doctor. Turning now, we'll begin our first round to the official opposition. MP Lawrence, you have the floor for 6 minutes.
Thank you, Mr. Chair. I'll just start with a little bit of a statement here. So, in accordance with the report from the Auditor General, the objective of this audit was to determine whether the Public Health of Canada administered quarantine requirements for incoming travelers to limit the introduction and spread of the virus that causes COVID-19 and its variants. Your scope surrounded Ms. Hogan, what restrictions were put in at the border. It is clear that the controls were not as effective as they could have been, slowing the spread and reducing the transmission of COVID-19. However, my line of questioning is actually going to be focusing on the scope of the audit. I have some questions with respect to that. My concern is that the scope of this audit and many of the questions will be put, like I said, to the Auditor General. I'm concerned that despite numerous media reports, Ms. Hogan, that your scope did not include the numerous terrible conditions within and civil liberties that were violated within the quarantine hotels and the enforcement procedures. And I would cite the article in the National Post from December 7th, 2021, written by Christopher Nardi, in which he cited evidence of individuals complaining about going hungry, living in dirty clothes. And also, and even more troubling, there were multiple allegations of sexual misconduct, both within the quarantine hotel system and at compliance checks. To quote the Canadian Press article from National Post on February 24, 2021, the accused informed the victim that they were in violation of the quarantine order and demanded that a fine be paid in cash. When the victim declined to pay, she was sexually assaulted by the accused. Moreover, to quote the Canadian Press article in CTV News on March 10, 2021, operators have been telling single women not to tell people of their location, and in some cases that there are no locks on the doors within the quarantine facilities. Ms. Hogan, given these blatant civil liberty violations, why didn't you not include the operation of the quarantine facilities and also the enforcement checks and the potential abuses to Canadian civil liberties within the scope of your audit?
So I will ask Ms. McCullough to add to this with a little bit more detail. I do know that part of our work included looking at the security measures that the Public Health Agency had in place to monitor the quarantine facility as well as the government authorized hotels. During the scope of our audit, there was one issue that I know we were aware of that had been investigated in rather detailed fashion, I do believe, by the agency, and that measures were being taken to address it. I am going to see if Carol maybe wants to add a little bit more flavor to that in the response. Thank you.
Thank you. We did look at the security requirements that the Public Health Agency of Canada did require of its quarantine hotels, which it had approved to receive incoming air travelers, as well as the arrangements that put in place at its quarantine hotels. And we did see that the agency in both cases had established the security requirements for these hotels and did put in place measures to verify that they were in place and functioning as intended. Following an incident at one of these hotels, it did conduct a review of its security procedures and put in place recommendations to improve the security. And during the course of our audit, we saw that the agency was working to institute that across its quarantine hotels.
Thank you for those responses, but my concern is that it doesn't appear as though, although there may have been policies put in place, is that at the end of the day, it's the results that matter and the impact. How many of the people in the media or otherwise that reported complaints did you interview, or how many members of the general population, not just government officials, did you interview to see what the experience was truly like at the enforcement checks in the quarantine hotels?
We didn't interview members of the public or travelers who had stayed at quarantine hotels. We did contact different agencies who were involved in setting these up. For example, hotel organizations, and they had talked about the situations that they saw at the hotels and were put in place, and to the extent that they were consulted in those measures?
Thank you. And as I think you might have mentioned in your statement, it's clear that vulnerable populations such as women, BIPOC individuals, and members of the LGBTQ2+ community might be disproportionately impacted by misconduct by government officials. To what extent did you review and analyze the impact on vulnerable populations and apply a GBA plus analysis to the impact of the quarantine hotels and the enforcement checks?
So I know that during our analysis, when we looked at what the Public Health Agency had done for the gender-based plus analysis, we saw that they had collected information, but they really didn't use that information to and analyze it to see whether or not adjustments needed to be made. And one of the other recommendations that we saw that came out of their own analysis that hadn't been implemented was the bias training for many officials. And as you know, training and awareness is the first key place to start in order to drive a change here. And so we saw certain measures just hadn't been applied, and we weren't sure why.
Thank you very much. Turning now to MP Yip. You have the floor for 6 minutes.
Thank you, Chair. I appreciate the witnesses and for coming in today and their work done on this important study. I remember at a time when the quarantine hotel stays were introduced and there was a lot of reporting on who just walked on by without quarantining and also those who were compliant. There was an inconsistency and in the public's eye an unfairness and even worries about the border measures not being strong or effective enough to prevent the spread of COVID-19. Dr. Kochar, can you provide some examples to give us a sense of the breadth of the programs that PHAC had to establish in the implementation of emergency travel and border measures during this pandemic?
Mr. Chair, PHAC, I would say, was able to rapidly mobilize, adapt, and respond to the evolving COVID-19 situation, including administration of unprecedented border and quarantine measure programs. So a few examples. Agency established the program to follow up with travelers required to quarantine. Following March 2020, agency was able to establish a Quarantine Act compliance verification program, which made over 4 million live agent phone calls, 13 million promotional emails, 6.5 million robocalls, and also in-person compliance visits, which were directed to 540,000 travelers. And then in addition, Mr. Chair, we also established a compassionate exemption program. This allows the travelers who would otherwise be prohibited from entering Canada to attend funerals, provide care or support to critically ill persons. That we established that program and processed over 64,000 applications. We also had Canada Border Testing Program, which we talked about, where we were doing the surveillance to actually see how many of the travelers were coming in, and this was launched in February 2021. We tested 4.38 million on-arrival and post-arrival tests, and we analyzed them so that we could successfully detect and isolate infected travelers. And then as of August 2021, we moved on to mandatory random testing. Now, in addition, Mr. Chair, we continuously expanded and enhanced Canada's ability to limit importation by establishing emergency travel and border measures under different acts like Quarantine Act, designated quarantine facilities, data monitoring. I must mention this, that ArriveCan app, which is an application to capture the key public health information on travelers. At this point, over 80% of weekly travelers entering Canada digitally started to use that as of August of 2020. Now, those actions really conflated to the point where we could mitigate travel-related importation, specifically in November, if I may, travel-related importation of Omicron variant through our enhanced testing and quarantine requirements and travel restriction. On top of it, all of these measures, and including the testing program, allowed us to really concentrate on identifying any variant of concern by genomic sequencing in our laboratory. So this was a whole array of things, and I could go on, but I think that captures what we have done in Public Health Agency to support that.
Well, thank you. And I would like you to expand on that in terms of the recommendations of the audit. What changes and also what you just said, lessons learned were done to better combat the January Omicron surge?
So I will turn to my colleague Bridget on this one, because as I mentioned, there were some very specific aspects which were put in place on the Omicron wave hit us in November. And Bridget will probably be better able to explain and articulate them as they were rolled out.
Thank you, President, and thank you, Mr. Chair, for the question. Indeed, in November 2021, on the when Omicron came to light, the agency worked diligently to take some concrete actions. One of those first actions was to impose a country-specific measures that required enhanced screening at the border, including the requirement for travelers from particular countries to go to the designated quarantine facilities. The government also looked to increase the testing at the border. So a significant ramp up in the testing on arrival to determine which travelers were positive and required to be going into quarantine. And I would say that in doing so, we also had to ramp up our compliance and our follow-up activities in response to Omicron.
Do you feel that PHAC is better prepared to deal with the BA2 variant and other future variants, especially with the decrease in, or not decrease, rather, the random testing and the removal of the molecular testing?
So let me start by mentioning that we have had an experience over the last year and a bit in terms of both looking at the testing at their border, looking at an extensive testing regime, as well as shifting ourselves to mandatory random testing. Now, this mandatory random testing is one of the key components which has allowed us to really focus on a component which is allowing us to really say one of those aspects where we haven't had an opportunity to test everyone, but we can take a random sample based on an algorithm which is developed by CPSA, based on what is the travel history, based on the epidemiology of the country from where the travelers come in. And that allows us an insight, both in terms of the positivity rate of the importation through travelers, and secondly, identifying any variant of concern, because that testing which we do, any positive, is 100% sequenced for the genomic sequencing. That's why we are able to identify very early.
Thank you, Doctor. I suspect we'll probably come back to that issue. I'm turning now to La députée Sinclair.
Member Sinclair Dangagne, you have 6 minutes. Thank you, Mr. Chairman. And I thank all the witnesses here today before the committee. And I want to congratulate the Auditor General for having put an end to the strike and negotiated an agreement with the services in her office. So congratulations. I want to begin my questions with a brief comment about the role the government played in the delay fighting against the propagation of this virus. We found that the government was always late in regards to what was necessary to limitate the spread of the virus. The first example we saw was that people were very upset at the biggest airports in Canada, such as Pierre-Elliott Trudeau, and it was the mayor, Ms. Valérie Plante, who had to send people from the city to try and stop these arrivals because there was no control at all at the border. Nothing was done. The federal government was just waiting. I want to quote the mayor who said that it was a sieve at Montreal Airport, and she sent some 60 people from the City of Montreal's public health to establish some better measures for public health. So that's the first finding. Second, the government did establish a 2-week quarantine period. However, and this is where the Public Health Agency of Canada, in my opinion, could have contributed more, which is that we were always lagging behind. There was a 14-day quarantine period, whereas many countries, after being aware of for several months about the pandemic, we were still at the 14 days. We knew that with science, after almost a year of the pandemic, that things had changed. So in Europe, they had moved to a 6 or 7 day quarantine period. There was a test on arrival and a test a week later, and if both were negative, the person was free to go. But in Canada, we were still with the old measures, being incredibly cautious, and the Public Health Agency of Canada hadn't sent the information and the data, whereas the government just decided not to do anything about this. And I've lived this very personally. My father and my uncle, respectively, on days 10 and 12 of their quarantine, were not able to say goodbye to my grandfather, and that could have been avoided. So in this case, I think that the Public Health Agency of Canada could have done a much better job of watching over this and better practices and implementation of measures as well. So I thank the Auditor General's office for have done several studies and having showed us where things could be improved. But even in these measures, there was a lot of progress that needed to be made, and we were always lagging behind. And I think it's unacceptable for a developed country such as ours. So, based on all of that, my first question, Ms. Hogan, in your opinion, is the data and information that was collected through these quarantine and screening programs, could this information help to improve or correct the measures set out by the government? I will start by saying that I'm very grateful that we have reached an agreement and that all employees are back in the office. They came back yesterday. And now, as an office, we have begun a period of healing. And I'm very anxious for us to get back to a new normal that will see us better supporting Parliament's role. Now, as to your question, you're right that the criteria or the requirements were clear, but the department didn't really do a good job of monitoring and compliance. They didn't demonstrate to us whether these requirements were indeed effective in limiting the spread. And in fact, we saw an improvement in the area of contacting individuals, but we didn't see that the department really learned lessons for automating the process, and certainly there was a lack of data to demonstrate whether or not these measures were effective and whether they should be indeed changed over the course of the epidemic. The Auditor General, thank you, Auditor General. That's interesting to learn that at this stage. My second question is maybe more one of correction. In terms of the data, 8,000 plus travelers arrived in Canada who had positive results. Can you confirm if it was really 14% were reached by the agency or 14% were not gotten in touch with by the agency? Are you talking about individuals who tested positive? Yes. Okay, well, I'll perhaps ask Ms. McCullough. I know that there were over 1,000 people who had positive results who were not contacted. Carol, could you give us the precise percentage of persons who were contacted?
8,000 incoming travelers who had tested positive. We found that the agency had not contacted 14% of them, or 1,156.
Et est-ce que vous savez...
And do you know? I'm sorry.
Turning now to MP Desjardins, you have the floor for 6 minutes.
Thank you very much, Mr. Chair. And I want to thank all the members today for joining us. And I also especially want to add my congratulations to the Office of the Auditor General for ensuring that the workers who were on strike in previous are now back in the office, and hopefully we can begin a good process of ensuring that they can continue to have a good and safe and dignifying workplace. So thank you very much for that hard work. Regarding this audit, I think what we're seeing here is something very clear, very blatant, which is that we don't have a nationwide quarantine system at our borders. That seems to be a very obvious fact. And I'm particularly troubled as an Albertan, as mentioned by my colleague from Quebec, the issue related in Montreal of having the mayor having to send support to the airport in order to actually see some confidence in public health. That's simply unacceptable. But I want to draw some comparisons in my home province where this didn't happen. We didn't have a city authority that had the ability to do that. So I want to draw particular attention to the fact that Calgary was also one of the 4 cities, along with Toronto, Vancouver, and Montreal, accepting international flights during this period. Yet there's no record of any hotel quarantine violations in Alberta. Most Albertans know there were violations. People were upset about these violations. Members of the airport and the city themselves tried to address these concerns. Well, I understand from reading this report that there was some requirement for cooperation by provincial authorities in order to make sure there was a particular level of enforcement. So provincial leadership in Alberta, and also in Saskatchewan in this case, had either refused or not wanted to really just tackle this issue by adopting the regulatory procedures or the authorities required to enforce some of this, like the ticketing system, for example. So despite years of the global pandemic, despite years of understanding that we didn't have this cooperative system, we're at this point where we had this kind of hodgepodge of jurisdictions when we really needed a nationwide one. So there's really a large concern. My concern is the provincial governments, or this PHAC's ability to work with provincial governments to sign on to things like the Contraventions Act. So offences under the Quarantine Act can be dealt with in other provinces through the simple process of issuing tickets, is my understanding. But Alberta and Saskatchewan have refused to sign this, or maybe some clarity can be provided here, to severely limit the ability of police to enforce quarantine measures and issue fines for infractions. The audit clearly shows that the results of this gap were in BC, for example, just a jurisdiction just west of Alberta, there was over $3 million in fines issued to quarantine infractions. So we know they were happening. In Ontario, there were almost $18 million in fines. But in Alberta, despite being home to one of the 4 airports just mentioned in the country that accepted international flights, and the authorities there issued $0 in fines. So this is a massive gap in our ability to enforce public health measures, and leaves Albertans in particular more vulnerable to new variants when we can't understand or enforce these things. Could both the Auditor General perhaps comment on the follow-up of some of this work, and also the Dr. Kahar related to what the ministry's plans to do about this huge, obvious inequity?
Mr. Chair, I'll go first, and then I'll leave some time for Dr. Kachar. The purpose of the ticketing regime was really to see national enforcement of quarantine measures across the country. And it was clear from our findings that the Public Health Agency hadn't worked through a cohesive enforcement requirement across the country. As you're right, some provinces and territories did not sign on to the Contraventions Act, and then hence ticketing could not be done. And so when you put in a requirement, you really do have to think through monitoring and enforcing, and there are many tools that could have been used, and that is something that needs to be improved to deal with a better planning for another health crisis should one occur. And I think I'll leave it to Dr. Qatar to add to that.
I'll just add, Mr. Chair, that as much as we were working very closely with RCMP, provincial and municipal law enforcement agencies to verify compliance with quarantine functions and obligations order, there were, very good cooperations and specifically failure to comply with quarantine, isolation, and other obligations are actually an offense under Quarantine Act. So those who receive their test results directly from the companies and from provinces and territories also received the same information for follow-up, and this happened electronically and immediately at the same time. So we continue to work with them. Of course, the Contraventions Act is something which is very specifically in that context, not in certain provinces, but we continue to make sure that there are multiple layers where we could reach a traveler regarding the result and ask them to do the right thing. And not only with just the fines and enforcement, but also compliance promotion by calling them and advising them about their obligation to really have those periods of isolation, quarantine, or the day 8 testing. So those were the components which we try to institute in addition to what we could in terms of our ability to really identify those positive individuals at the border testing.
Thank you, Doctor. That ends our first round. Moving to the second round, we turn to MP Duncan. You have the floor for 5 minutes, sir.
Thank you, Mr. Chair, and thank you to our witnesses for being here today. I want to follow up. I'm a little bit, I don't say rattled would be the right word here, just about the lack of information or response here on some of the allegations in the hotel quarantine program. The title of the report is Enforcement of Quarantine and COVID-19 Testing Orders. Ms. Hogan, through the chair, can you explain why this program was not studied more in this report? Maybe provide you an opportunity. Is this something perhaps that your office is looking at or going to be doing a study on going forward in terms of, we talk about effectiveness of government programs or policies. Is this something you're going to be studying or confirm to this committee that you're going to? And if not, why not?
So we currently don't have any plans to look at other border measures. Now that is considering where we are in the pandemic, that can obviously change as we move forward. We do monitor the environment and make decisions. I guess when it comes to speaking with Canadians directly, we've found in other audits that there's sometimes a hesitancy to want to speak to us, especially when it's very personal, a personal matter. We did look at how the Public Health Agency was ensuring security. It really is the agency's responsibility to ensure that there is adequate security at these facilities. And as I said, we found that they were following up on incidents. And so if we decide to look at another audit on border measures, we'll obviously consider it. But since the government authorized hotels are gone, now there's just quarantine facilities. We could consider that as we move forward. But as I said, our current plan is not to do a third audit on border measures.
Well, I may be following up perhaps through the committee here on some recommendations on that, because there were charges laid. When we talk about a gender-based analysis, the lens at which we look at this, if we have allegations of women being sexually assaulted as a result of, through this program, and some of the measures. And I'm just going to note through CTV News that the committee where then Minister Blair, Public Safety Minister, had stated that police had arrested 2 men accused of sexual assault related to quarantine measures, one at a Montreal hotel and another tied to a compliance check in Oakville, Ontario. And it said the accused in the situation there in Oakville had been trained by the Public Health Agency of Canada as a designated screening officer under the Quarantine Act. And so I just go back again of where when we talk about a gender-based analysis and protecting vulnerable populations in this, I just don't understand how a red flag is not raised there to say this might be something and to your, Ms. Hogan, I agree, it's not your responsibility, obviously, to coordinate security, but that the review of the government program of how employees are vetted or trained, or if there's, vulnerable populations or women that are being, having people visit their home while they're alone or something. I'm just very surprised that this is not raised as a red flag in any way, that this might be worthy of an audit, particularly when it comes to a GBA lens.
Oh, I think you're on mute, Ms. Hogan.
I can't believe I did that for the first time in 2 years at a hearing, but thank you. I do believe in the cases that you're talking about, law enforcement was the right party to do that investigation and not our office. And I'm happy that they followed through on that. I do take your feedback under advisement as we consider whether or not we want to do another audit on border, and as we continue to improve our auditing on through a GBA plus lens.
Appreciate that, and clarify further. I wouldn't expect an investigation on those specific measures of the allegations. Law enforcement and a due process through court would obviously be most appropriate, but perhaps additional screening or security measures, or how people were hired, how individuals went to people's homes, whether the individual was alone or whether they were accompanied with somebody, recording documentation and so forth, might be ways, or a review of a program and measures put in place through existing programs that way. In my limited time left, and I'll hopefully elaborate this possible if I get a further round, I just want to ask Ms. Hogan as well about the problem resolution process. And numerous colleagues so far have raised some frustrations about where, and there's been media stories about an issue, a glitch with the ArriveCan app, or somebody only providing the second dose proof, not the first, and being required to quarantine for 2 weeks. As part of your review into the efficiency of these programs and the department's ability to respond to them, do you look at the complaint resolution or problem resolution process at all when it comes to these programs and Canadians being able to reach somebody to resolve?
I'm going to cut you there
problems?
just so we can get a brief answer from the auditor.
Thank you, Mr. Chair. In this case, we did not look at the IT system and whether it was operating effectively, and we did not look at the complaint resolution. We were looking to determine whether or not the agency could explain to us whether these border measures were effective at limiting the spread, recognizing that we were still in the midst of the pandemic, and it was to inform future adjustments and responses.
Thank you very much, Ms. Hogan. Turning now to MP Fragascatos. You have the floor for 5 minutes.
Thank you very much, Chair, and thank you to witnesses for appearing today. In looking at some of the key highlights of recommendations that the Auditor General has put forward, and this question goes to Dr. Koshar, and Dr. Koshar, if you wish to direct it to colleagues, that's fine. But one of those highlights reads as follows: the agency should improve its capability to achieve a consistent enforcement approach to border measures nationwide, including exploring other tools that could be used in all Canadian jurisdictions. What do you make of that recommendation, Dr. Koshar, and how has it proceeded? How have steps been taken to implement it at this point?
Thank you for the question, and I think the couple of things which, and I will direct it also further to my colleagues here, but just to start in terms of, the compliance piece is very specifically, we have a way to really promote the compliance by having a clear communication package for anyone who is coming in through the travel, borders and so on. But the enforcement piece is also directed to gradually move the people to a regime where they are self-directed to make the right kind of call. So, for example, if you are a person who has come in and we need a day 8 test done, our email system will generate that. Our, robocalls will remind the traveler that is what we need to do. And those aspects in the compliance promotion world allowed us to gain much ground. In cases where we could not actually really have the ability to connect or get a response. We did use the law enforcement agencies and door knocks, which I mentioned, more than 540,000 door knocks in terms of that. So the enforcement was in that. I would shift this to Jennifer in terms of any other components, more importantly, the ones which included ticketing or other aspects, which Jennifer can probably explain a little bit more in terms of our other tools which we've used.
Thank you, President. So just to reiterate some of the messages that have been outlined by the President, although FAC could not issue contravention tickets across the country, we did have a national consistent compliance and enforcement program. And the President has outlined some of those components, but I will reiterate them. Our compliance and enforcement program ranges from compliance promotion, education, through warnings, ticketing, and possible criminal prosecution. All travelers coming into Canada, regardless of where they enter, they do receive the same treatment by the Public Health Agency with respect to compliance and enforcement. And what I mean by that is that these individuals receive the compliance promotion emails and robocalls, as the President has outlined. They are also subject to compliance verification calls. These are the testing requirements that the President pointed out as well. If there is reason, we do refer them over to security companies for in-person compliance verification visits. And if required, we do send them over for law enforcement referrals. We have undertaken work to respond to the Auditor General's recommendations with respect to compliance and enforcement. And work has commenced with law enforcement and police of jurisdiction to enhance our CNE posture. We undertook meetings with these police of jurisdictions, and we have come out with some short to longer term proposals to respond to some of the vulnerabilities that have been identified by the Auditor General. And just as a means of providing a couple of examples, what we're looking at with respect to a response is focusing law enforcement referrals on high and urgent priorities only. So we would focus their efforts on those cases, as well as developing an enhanced technological solution to facilitate reporting. On the other aspect that you brought up with respect to more of a policy response, we are looking at mechanisms how we can enhance our capability of enforcement, which by that I mean ticketing, or some other type of monetary mechanism to ensure compliance. However, those are in the initial discussion phases.
Thank you. I'm afraid that is all your time.
That had already been taken up, Mr. Chair, but that was something that was unaddressed. So thank you very much.
You're very welcome. And thank you to our witnesses. Madame St. Clair.
Ms. St. Clair Desgagnés, you have 2.5 minutes. Thank you, Mr. Chairman. I'll continue along the same lines as my previous questioning. If I understand correctly, 1,156 people tested positive, but were not reached by the agency. Therefore, my question for Dr. Kochar, how is it possible that we did not reach over 1,000 people who had tested positive to ensure that they were complying with the public health guidelines?
Thank you for the question. I'll start, and maybe Bridget or Jennifer can pitch in on the aspect of where we are. So what we are talking about is in terms of Auditor General looking at a whole spectrum of how many of those positives which we could not tally that they were actually contacted. So a couple of pieces which I do want to mention. There are errors sometimes from the ArriveCAN to what they actually put it into the electronic registration or the registration for the tests, which did not allow us at the very beginning the immediate kind of confirmation that they are the same. Secondly, at times there were situations where the tests were received or results were received a little longer or beyond the 96 hours, given that there was more of a virtual test, and it took time for us to really coordinate that. However, we tried to reconcile the results as best as we could, and having an ability to really follow up, as I mentioned, through different layers. For example, calls, for example, all the others, to do the right thing, to remind the people that if they have, been in the travel and they need to quarantine, they are reminded to quarantine. Bridget, I don't know if you want to add anything onto that.
Thank you, Mr. President, and thank you for the question. I have to say that we have continued to look at the data and look at how we can improve the tracking of the test result, and our completion improve over time. From 76% and 61% in February 2021 to 95% and 82% in June 2021, respectively. Alors, on continue de faire.
So we continue to make progress. We accept the Auditor General's recommendations and we take them very seriously. We're currently working with all of the companies from the private sector who are doing the screening to see how we can improve even more and have electronic processes that are more highly developed to track the test results. Thank you very much, MP Desjardins.
5 minutes.
Thank you very much, Mr. Chair. And just to follow up on my former line of questioning regarding enforcement and uniform enforcement across Canada, and in particular Alberta, and particularly the Calgary International Airport, it was just mentioned, I think, in previous by the Deputy Minister that there's hopes to ensure that there's financial penalties moving forward, and that work is ongoing. But how can we ensure that if provinces like Alberta don't sign the Contraventions Act? Maybe the Deputy Minister could respond, or Dr. Kohar.
Yes, so I'll start. Of course, there are multiple tools, Mr. Chair, in terms of making sure that we are able to enforce the law, both in terms of working with the local jurisdiction, the law enforcement agencies, but also, as my colleague mentioned, we are exploring the other options which we could actually put in place so that we are better equipped, have more tools, which are very much in the initial stage of discussion, to see what would give us more of an ability to really have another tool in our toolbox to make sure that if such a situation arises again, we are able to have a proper enforcement vehicle, whether it is through the monetary aspects or whether it is working with the provinces and territories. As my colleague said, we are in the initial phase of discussions internally, and we will continue to move forward in terms of discussing this more.
Particularly, what are those tools? Like, if Alberta says no way to the Contraventions Act and continues to do that, which puts, of course, uniform enforcement at risk and allows essentially an open door policy for folks coming into Alberta, what stops them from just going to BC, Ontario, Quebec, anywhere else if they get through Calgary? There's really just no point in enforcing it anywhere else if we're not going to enforce it uniformly. So it's really important that Canadians understand what tools the Canadian Public Health Agency is using.
So, Mr. Chair, we continue to, as I mentioned, explore some of those. Jennifer may be able to shed a little bit more light on where we are in terms of our initial discussions.
So we're assessing all possible options with respect to enforcement. Just by way of example, other government departments that I have worked at, such as CBSA as well, I know Transport Canada has administrative monetary penalty regimes that could be used as a potential example or model going forward. But as I indicated, and as the president has indicated, we have just started these discussions, and it is too early to come down with respect to a recommendation.
Thank you very much. Thank you very much. Turning now to MP Patzer, who's joining us on Zoom as well. Over to you. You have 5 minutes, Jeremy.
Thank you very much, Mr. Chair. I'm just going to start with the Public Health Agency of Canada. I'm just wondering, can you give me a really quick definition of what you guys use to determine if somebody is rural, like from a rural area or not?
So the information probably provided in a can would give an idea of whether they are from a particular jurisdiction based on the information they add in there.
Great, but does your department have like a uniform definition for rural?
I think
maybe I can add, President, that typically we would be working with Statistics Canada definitions of urban versus rural definitions.
Okay, thank you.
Yes.
Thank you. To the Auditor General, in this report, I couldn't help but notice that I don't think even once there was any consideration given to people living in rural areas of Canada. I'm just wondering if you have anything to say to that, or if you want to elaborate on just the lack of enforcement, or maybe just the issues of enforcement just on rural Canadians.
Well, we didn't focus in, obviously, on rural Canadians. What we did was look at whether or not the Public Health Agency had worked through that sort of cohesive enforcement regime. And as we've been talking about this morning, that wasn't thought through when the measures were put in place. And having clear guidance that's well understood comes with a good monitoring and a good enforcement regime to ensure that it's being followed. And I do think that that's one of a good lesson learned as we move into the next wave or start planning for another health crisis that must come our way, is that enforcement does have to be cohesive if you want to have it be effective across the whole country.
Yeah, no, absolutely. I couldn't agree more with that statement. And I'm just going to kind of strengthen that by saying, from one of the largest rural ridings in Canada, I had lots of ranchers who were calling my office and talking to me and just saying, hey, I just spoke to somebody from Public Health Canada, and they were telling me that I can't leave my house to go look after my herd, look after my cattle, like be in the middle of calving season. And I mean, these people have jobs to do, and they're out in the literally living hundreds of miles away from any major center. They're not going into town. They're literally going to look after their herds. It's their livelihood, but it's quite frankly about our food security and looking after our supply chains. And they're telling these people they can't leave their house. And again, with our grain farmers, same thing. I mean, these people they were told they couldn't leave their house, but yet their job by nature is isolating. They go sit in a tractor all day and then come back home. So they're not at risk of spreading transmission, but yet there was no recognition of this, like to public health, like there seemed to be no flexibility on this. I even had a senior who had a pay by use phone and ran out of minutes in like day 3 of his quarantine and lost contact because he couldn't call anybody for the next 11 days, and he couldn't leave his house to go buy more minutes for his cell phone. There seem to be all kinds of gaps like that. Just wondering what's being done to rectify those situations, and being willing to consider the fact that not everybody lives in downtown Toronto.
Jennifer, would you mind answering that?
Order. I'll allow the witness to reply, please.
Sorry. So, I mean, each case that is presented to a quarantine officer or screening officer is assessed on its individual merits. I know that our officers are provided flexibility with respect to assessing these cases, and they're provide the discretionary authority to weigh exigent circumstances. On the whole, you're correct. The officers are administering the Quarantine Act and do stipulate that quarantine must be obviously in their particular dwelling and so forth. So our officers do take that into consideration. The situations that you've outlined here are unfortunate, and I recognize that they are very unique with respect to the rural nature, but I'll leave it there.
Thank you. I'm afraid that is the time. MP Patzer, turning now to Ms. Shanahan. You have the floor for 5 minutes, please.
Very much, Chair, and I'm very interested in the questions that have been posed by all members of this committee to date. And so just to follow up on Mr. Patzer's question, regarding rural versus urban, I think we can, and earlier questions that we had on gender-based analysis plus being used, and of course that's part of the recommendation. I would like to hear from Dr. Kochar on what is the work being done. And I know it's an ongoing thing. When I first arrived here in 2015, GBA plus was barely on the map, and in fact I am so encouraged to hear that members on all sides of this committee are now using the GBA plus analysis framework to look at those vulnerable people that are have unintended consequences when we put programs in place. And it's not easy to do in normal times, but if we can hear from Dr. Kochar on what the Public Health Agency is doing now in this area, because we're talking about sectionality, if I've got the term right, of a number of different factors, of which rural and urban can certainly be one, and certainly the anything having to do which affects a person's identity and how they're affected by programs. Please, Doctor.
Absolutely, Mr. Chair. So in reality, we have worked quite a bit on this aspect. We've developed and implemented mitigations to identify disparate impacts of border measures on vulnerable groups to the extent possible, and to by operational policy, we've tailored the accommodation we provided for families, caregivers who are required to stay in designated quarantine facility. So we continue to focus on what are the vulnerabilities, what are the pieces which we need to actually tailor our programs based on that. We also did amendments to OICs, or order in councils, to create exemptions for several cohorts of potentially vulnerable travelers, including persons living in border communities, persons living in remote communities who needed to cross in Canada and US border, then those in a compassionate circumstances, for example, to be present for the final moment of life of a loved one or attend a funeral and other. And then on top of it, Mr. Chair, what we tried to do was provide specialized training on gender and diversity consideration to our frontline staff, so that at the border and at the DQFs, or designated quarantine facilities, they are aware, including training on bias, which was launched last September. We also gave training on security awareness and de-escalation of that. And we continued on with that, and we are still continuing on to that. With the ongoing renewal of emergency orders in November, we also started to update our GBA plus analysis and to incorporate any of those results which we get from those analysis for our future border measures. So we have been very focused on those components, as was mentioned in the recommendation by the OAG, but also doing our part to make sure that we are improving ourselves both internally and with our policies focused on the GBA plus.
Well, I'm looking forward to the progress. Chair, how much time do I have? All right. Well, I did just want to add to the remarks of my colleagues, Madame Sinclair Desgagnés and Monsieur Desjarlais, concerning cooperation with provinces. Just a word on how did that devolve to cooperation with municipalities, who are, of course, have their own police forces and would have been very much concerned by enforcement of the Quarantine Act.
So, Mr. Chair, most of the work which we did was with the provinces and also at the local jurisdiction level, because, for example, the Toronto had a municipality of the Peel region and 3 other municipalities who had the law enforcement officers who would actually follow up. And similarly, as I mentioned earlier, there were multiple layers where we could reach out to those who were supposed to be quarantining or were not in a proper kind of a setup through our outreach basis, as well as making sure that our law enforcement agencies were informed properly so that they could follow up with a proper enforcement piece.
Thank you very much, Doctor. We're now going to our third round. MP Duncan, you have the floor for 5 minutes, please.
Thank you, Mr. Chair. And I want to follow up again on the where I was going in my last round about the problem resolution process. And I'll, just for the record, there was a article in CBC back in December regarding a couple, Eric and Carrie Langer. Just a quick summary of theirs. And in the article, this past summer, several travelers were getting robocalls reminding them to quarantine even if they weren't required to. But specifically in the case of the Langers, they pulled into the Thousand Islands border crossing to return home. The ArriveCan app with their proof of vaccination wouldn't load on Eric's phone. The officer refused to look at their printed documents and ordered that they quarantine for 2 weeks. Carrie is a teacher at a short-staffed elementary school. She said taking that much time off wasn't an option. So when they got home, they started making calls to elected officials, to the Public Health Agency of Canada, and to CBSA. And Eric quotes, "The resolution should have been that somebody calls to verify that we are indeed vaccinated. Boom, the quarantine is lifted, but there's nobody. There's no information. It's crazy." So Dr. Kocher, can I just get you on record perhaps to explain, when we look at this, we're looking at the review of a government program and policies and how they're enacted. But I'll go back before. I believe a key aspect of this is when there's a glitch, when there's a problem, when there's an easy resolution to not require somebody to quarantine for 2 weeks in this case. What was your problem resolution to deal with those types of issues? Was there any? Was there any call volumes? Have any changes been made?
Thank you, Mr. Chair. And I'd start by saying that the Public Health Agency verifies travel compliance with emergency orders through live calls with screening officers and also automated interactive voice calls, or a combination of both. So that is what we do. And we leverage the contracts or MOUs, which we have with the Service Canada and Stats Canada, both federal entities, to complete up to 8,000 live verification calls with travelers daily. So that is the kind of way we try to reach out. And these compliance verification calls can begin as early as day 2 following arrival into Canada and may continue the entire 14 days, just to ensure that we are reaching the traveler. And travelers who have an indication of non-compliance, specifically with emergency orders following a compliance verification call, they are referred to the appropriate, police of jurisdiction. In relation to whether, there are the components of where there is a glitch in the system or others, we do have our call centers or lines where people can call and they would get support in terms of rectifying or finding other solutions onto that. And to be more precise, Jennifer, who deals with the on the ground kind of things.
Yeah, I don't mean to be rude, but I just want to try to get a couple supplementals on that. And what I'm asking would be secondary issue to that. So, for an example, we had constituents, and my constituency staff would call the Public Health Agency of Canada and explain, for an example, the situation of the media story I referred to. I'll give you another local example. I had a constituent, husband and wife went to the U.S. They drove back. She had the proof of her second vaccination, not the first. They said, nope, we need the first. You're in quarantine for 2 weeks. She just couldn't find it on her email when they were at the border. She just had the second one, called public health, and the answer was, nope, that's just too bad. We don't have a process to actually change or amend that. So if I can just get you on record, yes, there was a phone number, but was there a process where if there was an opportunity for a Canadian to say, look, sorry, the ArriveCan app didn't work. Here's my proof of vaccination. Oh, I'm sorry, I didn't have the second copy, or my first proof of dose. So here's my second one. Was there were you resolving these issues, or just saying, sorry, no, that's the discretion of the officer. We can't reverse course on this? Was there any sort of program at all to address those types of concerns?
Thank you for the question, Mr. Chair. If I may, please pass it on to Jennifer, who, as I mentioned, is closer to that and managing that. Jennifer, if you could.
Sure. So the cases that you're referring to, I'm going to obviously not address the particular details. I am aware of one of them in particular. With respect to entry at the port of entry, the admissibility determination is done by the Canada Border Services Agency based on information and instruction from PACP. So it depends on what happens at the border and what type of information is provided to that officer, and they render their decision. Once that officer renders that decision, the BSO, that decision stands. If there was an error, or not even an error, if there's supplemental information and so forth, that could have been provided into CBSA or into FAC, but the admissibility determination is made by another government department.
Thank you very much. Mr. Dong, you have the floor for 5 minutes, please.
Thank you very much, Chair. I want to thank the witness for coming today. And to the AG, I read the objective of the study. The time period you looked at was July 1st, 2020 to June 2021, and that's following your previous audit. And did you find improvements from PHAC in terms of reporting on non-compliance and enforcement?
So you're correct. This was our second audit. The first audit covered March to June of 2020. Where we did note some improvements from the Public Health Agency was in their ability to actually contact travelers to determine whether or not they were quarantining. So in the first audit, we found that they were unable to follow up with 66% of travelers, and that improved to only 37% of travelers. I guess I would highlight two things there. At the beginning of the pandemic, very few people were entering the country. So even though the percentage has reduced in the second audit, the amount of travelers that come in has dramatically increased. And so it isn't a huge success story that about a third of the population can't be followed up with.
Thank you. Thank you for that. So there were some improvements. To the President, I know screening is sort of interwoven with different jurisdictions, and the goal is to filter out those incoming travelers with positive symptoms. Can you explain to me, first of all, how big is your enforcement team and frontline team? Just give us an idea on the HR.
I'd start, and Jennifer will be probably able to provide a precise number. We have quarantine officers at different ports of entry, which are almost, which manage the 24/7, at that time. We do have screening officers also, which are the correct number as of March 28th, I think, and I have that information with me, is that almost 59 staff, which is really assigned in terms of virtual assessments and who are doing those at the 36 different sites. Also, at 4 international airports, we have a physical presence of Public Health Agency of Canada employees. We have physical presence of around 36 points of entry, including 10 airports. Total staff complement, if I may, is of around 410, approximately that, with an average of, almost 100 employees on site per day, 110 sites on employee. So, and also, I do want to mention, Mr. Chair, that we do provide remote support also in cases where it is needed. So there is a mixture of on-site presence as well as the remote presence, which is assisting the travelers through the public health agency.
I got more questions coming at you. This is important. I just want to make sure that everyone understands the put it in a perspective that your team versus the rest of the team fighting on front line against COVID. I'm talking about including the municipalities and the province as well. So I understand your goal is to identify, test, and inform, and follow up and enforce if those decide not to comply of all travelers, right? But I see that the finding is that there were a significant number of travelers that got missed. Filters. Does that mean that those that got missed are amongst public in large, or there are additional layer of screening, whether it's provided by the province or the municipalities, should be able to trace them once they arrived in Canada?
So, Mr. Chair, there are multiple layers which would work in tandem. So one is just in the arrival front. Second is our ability to correlate the data which is provided by the testing service provider, because that information directly goes to the provinces and municipalities where they live, as well as the service provider and to Public Health Agency of Canada. So we do have the system where provinces can also do the needful onto that. And thirdly, as I mentioned earlier, where we see that there is information available and needs an immediate attention based on risk base, we obviously use our ability to have door knocks or people go in there, as well as informing the local jurisdiction, police jurisdiction.
Thank you very much. And now
giving the floor back to Ms. Sinclair Desgagne. You have 2.5 minutes. Thank you, Mr. Chairman. I thank the witnesses once again for their previous answers. And I'm staying on the theme of people who tested positive upon arrival. So they were infected with the coronavirus. I hope I can give me a brief answer. What did you do for the tracing and tracking for people who were in the same plane, for example, that those people might have been infected and been unaware? I'll answer that question. The agency worked closely with Transport Canada and the major airlines in order to ensure that when there is a case detected or a positive case reported on a given flight, that the information would be available on the website of the agency so that travelers who were on the same flight would be aware of it. But it's particularly the provinces and territories who do the local follow-up with travelers in terms of tracing. Perfect, thank you. So did you therefore test the other passengers? Were the co-passengers tested to see if they themselves had contacted the coronavirus? Well, that is the responsibility of the provinces. once someone has had a close contact. Up until recently, the policy has been that the provinces would ask people who were in contact to go and get themselves tested. And what recommendation do you make if people are vaccinated and they no longer need to isolate? What recommendation do you make in this regard? Indeed, to continue to be vigilant for people who might be positive upon arrival. Well, for the people who arrive in Canada, we have a screening program that is random in order to check on the virus coming into the country. But we continue to provide travelers with information to educate them on the personal measures that we recommend they take in order to protect themselves and the people around them. Thank you very much.
I have the floor for 2.5 minutes.
Thank you very much, Mr. Chair, and thanks again to the witnesses present here for this important discussion. I want to make a special mention in regards to the fact that there were 2 audits in this particular instance where we had recommendations for the quarantine process once already, and there was follow-up. We heard from the Auditor General just in her opening remarks that we still, of course, have issues related to the enforcement, in particular in some jurisdictions like Alberta, and I want to follow up with my questions in previous regarding that. So I had heard in response that there are tools, but I asked specifically what kind of tools can we assure Canadians with? Should our public health agency have to respond to something similar again? And I really appreciate if we can be brief. To the Deputy Minister, perhaps.
Thank you, Mr. Chair. And as my colleague mentioned earlier, Jennifer mentioned earlier, that we are at the exploratory phase where other tools, as was earlier mentioned, administrative monetary penalties or some other kind of legislation which we will have to look at. All of those are being discussed with the partners because this is going to be something which we can work with our partners at the borders, CBSA and public safety, as well as our provinces and territories onto that. So at this point, again, at the exploratory phase, there are a few of those options which we are looking at.
Okay, so we have one, an administrative financial penalty is what I've heard about so far. I'm still not satisfied with that response and understanding that issue, but I'll move on. This is the 3rd time I've asked that question related to what tools, so maybe I can get a response later on that. But regarding the issues related to if we do not, maybe the doctor can respond to this, if we do not fix the enforcement problem at the intake borders, the 4 airports in particular, what are the risks to Canadians, particularly in light of new variants?
So, Mr. Chair, the aspect of mandatory random testing at the airports actually allows us to use a more often way to screen those at highest risk coming from the countries which have a higher incidence of COVID-19. So, as I mentioned earlier, we test them. That's a part of their mandatory random testing, and then we sequence them. And that is how we get a clearer picture as we come in of any variant of concern which is going to be arriving through the borders.
Thank you very much, Doctor. Turning now to MP Lawrence, you have the floor for 5 minutes, sir.
Thank you. I actually want to continue on the line that my colleague, Mr. Desjardins, was on, but taking a slightly different tact. Is incarceration currently being discussed for people who are non-compliant of the Quarantine Act?
No, we are not discussing that specifically. I have to say that while the president mentioned and my colleague Jennifer mentioned that some provinces are not signatory to the Confirmations Act, we still have a summary of convention option under the Act, that would apply to all provinces and territory. It's just a much lengthier process that does not allow you to have an agile response. But that's a tool that we have currently in the Act.
So you are considering overriding provincial authority?
No, I'm saying that under the Quarantine Act currently, summary conviction penalties can be used in all provinces and territories, but we are not looking to jail travelers for not being in quarantine.
So even if a premier or a government of a province did not want to enforce the Quarantine Act through summary convictions, you would still proceed?
Yeah, that's the tool we currently have under the Act.
So you'd be disrespecting the province's right to enforce the Quarantine Act of their own accord and just going according to what public health thinks is best.
Mr. Chair, I'm only providing the tools that we have available. And I would like to take this opportunity to say that the vast majority of Canadians were very compliant with the requirements. We understand that this was very onerous, and we acknowledge all the sacrifices that Canadians have made.
I thank you for that, and I join you. I'm sorry, but my time is limited. I don't mean to be rude, but just to follow up, was incarceration, has it ever been discussed?
No, as a standalone mechanism, no, we haven't discussed incarceration.
What do you mean by standalone mechanism?
Well, I don't think that incarceration is something that we have legislative tools, we have acts that provide the mechanisms to ensure compliance and enforcement. But I can say that
Mr. Kocher, if I could, sorry, my time's short. Mr. Kocher, have you discussed any legislative changes that would give you the ability to incarcerate people for non-compliance of quarantine measures?
The short answer is no. We haven't discussed any of this yet.
Okay. Well, then why did you say that all options were available then?
What I mentioned in my statement was that there are other options which are available, and those which are pertinent to use in terms of having a collaborative, cohesive approach, both with the provinces and territories, as well as safeguarding.
Sir, but I believe the answer it would reflect that you said all options, and all options would include incarceration. Now you've told our committee that it's not.
Actually, just hold on. A clarification. It was actually not the president who said that. It was Jennifer Lutfala. Just if you want to direct your questions at that, but I don't want you to holding up one witness for a statement he did not make.
Thank you. So maybe I apologize for using the first name. I just can't pronounce the last. Jennifer, if you would like to respond to that.
So incarceration has not, I'm sorry, I'm getting a lot of feedback. Incarceration has not been looked at as a mechanism for enforcement.
I'm sorry, I'm just confused because you had said all options, and incarceration is clearly one of those options that would be used in enforcement, and now you're saying it's not. But just to clarify for the record, incarceration is not being considered, nor will it be considered as an option to quarantine noncompliance.
At this point in time, you're correct.
Thank you. Just to move on here, I'm sitting here just to be honest. I guess surprised, disappointed. We are ultimately all public servants, and we exist, our salaries exist because of the good people we serve. We have an Auditor General who's not talking to Canadians, despite the fact her vision statement saying that it's her responsibility to work for the auditor. We have Saskatchewan farmers who could be held in discompliance because they are not staying outside a dwelling, despite the fact that they have no risk, and worst of all, there's no resolution to this whatsoever. So there's no way of getting recourse, no due process afforded to Canadians. I would just press upon everyone on this panel. We are public servants. We are accountable to Canadians.
Thank you very much. Turning now to Ms. Bradford, you have the floor for 5 minutes.
Yes, thank you very much. And thank you to our witnesses for coming today. I've really enjoyed hearing your answers. Just to do a little bit of a shift, can you, I think probably Dr. Kocher is in the best position to answer this. How were the quarantine hotels selected? And what were the criteria for picking them?
I'll start by saying two things, Mr. Chair, that there are quarantine hotels which were referred to probably government authorized accommodation, and then there are the designated quarantine facilities, which are also hotels. So the GAAs are the government authorized accommodations. They were privately owned hotels that agreed to meet public health guidelines, and the selection criteria for the purpose of accommodating asymptomatic air travelers awaiting their COVID-19 test result. So there wasn't any contractual relationship between public health agency and the government authorized accommodation, and travelers paid for their own stay. The cost included the meals, the transportation, and security, which was provided by the GAA, and the mandatory hotel stopover requirements of the GAA were eliminated as of August 9th. But however, the DQFs, which are contracted and managed by public health agency, are to support symptomatic and asymptomatic travelers who do not have a suitable location for quarantine, or they don't have quarantine plans upon entry into Canada, and that's the last resort. And transportation and other services at the DQF or designated quarantine facilities, such as meals daily, are a part of the arrangement which public health agency bears, and there is no cost to the travelers. And this is in relation to reducing any of that any of the infection going out if they do not have a proper plan. And again, there are criteria through which we have actually made sure that the DQFs are adhering to the public health guidelines which we have prepared for those hotels.
Okay, thank you for that complete answer. The other thing I was wondering, we've talked a lot about compliance. I was interested to notice the great discrepancy between the uneven issuance of tickets for noncompliance. So basically, most of them, were definitely Toronto or Vancouver. Really not much happening in that line in Alberta and Quebec. And I just wondered why there was a discrepancy. Like 5,000 of the tickets were issued in Ontario, and there was only 6,203 totally issued. Why such a great discrepancy between how Pearson was handling this versus the other airports? I'm not sure who wants to tackle that one.
If it's okay, I'll jump in and respond to that question, President. Yep. The majority of the incoming travelers arriving from international destinations to Canada are actually arriving in Vancouver or Toronto. I believe it's over 50% of travelers arrive at those two airports. Similarly, at the land border, the majority of travelers coming into the country, again, the majority are coming in via Ontario. So it obviously leads to a greater portion of individuals that would have to be looked at from an enforcement and in compliance perspective. With respect to Quebec, you noted that there was a variance with respect to the ticketing. For tickets issued in Quebec, they actually have to go through a two-stage process. So there is a report written and provided to the public prosecutor in the province of Quebec, who assesses the case and the evidence as provided by a FAC officer and determines whether or not to go forward with the ticket. I'll also point out with respect to PEI, Nova Scotia, Newfoundland, as well as the territories and Nunavut, there is no land border. And none of the airports that were operating in those jurisdictions were actually accepting international flights. Therefore, there was no enforcement taken.
Okay, thank you very much.
You really have time just for a 10-second statement.
Okay, well then that's fine. Thank you very much. I appreciate your answers.
Thank you very much. Turning to the fourth and final round now. Turning to MP Patzer, and I understand you're going to try to split your time, but I'm leaving that up to you to do that, okay?
Sounds good. To the Auditor General, on page 24, section 15.61, the first sentence says the agency did refer more travelers at high risk of not complying with quarantine orders to law enforcement for follow-up, but did not know the outcome of 59% of these priority referrals. I'm just curious, what were the factors that were used to determine what a high risk of not complying individual is?
I believe that Dr. Kutcher maybe would be in best position to answer that, but there was a set of criteria given to individuals to assess based on their answers and so on, whether or not they were at high risk of non-compliance. So as you noted, there was an improvement in the ability to refer individuals to law enforcement and an improvement in the agency following up with individuals, but there is still 59% of those referred that were not followed up by the agency to know whether or not they were properly quarantined.
Hey, Dr. Kochar, quickly, do you have a quick answer to that?
We do have a set of criteria which which would put those at a higher risk. We could provide you if that is a better.
That would be fantastic. If you could provide that criteria to this committee, I would greatly appreciate that, and that would allow me to move on to my next set of questions. Going at the dollar figures here to the Auditor General, there was $614 million allocated for border measures. $342 million were for testing orders. I had a constituent that was told that because there's no courier services to where they live, that they're going to send a taxi out to where they are out in the rural area, which would have been a 4-hour one-way taxi. Well, ride. Well, not a ride, I guess, but I mean, it would have been it would have been an 8-hour round trip. Were those costs factored in the government's decision making on how they're going to run these programs?
I think that's an excellent question to ask to the department as to how they weighed the pros and cons in administering the COVID testing protocols.
But in your auditing, you didn't find any anything specific in the line items that you looked at when you're looking at the costing. You didn't find anything specific to anything like that.
We didn't identify an issue like that where taxis were being reimbursed, but we did not do a detailed audit of the $342 million.
Okay, Dr. Kochar.
Mr. Chair, what we have is a service provider with who we have a contract. This is incumbent on the service provider to make sure that those tests which are conducted remotely, they are provided to us. And there is that specific kind of a built-in system for which we have averaged the cost, and that is the cost which we pay. If there is an extraordinary cost, they will have to flag to us in that situation.
Okay, because there's an example I think it's in the Winnipeg Press that was one such case. There was a 660-kilometer round trip, and there was a taxi bill of over $1,000 to just simply get the test in to be able to be processed for this individual. And we're talking about timelines, getting results for people in rural Canada. By the time they do their 10-day result or their test, they still haven't even got the results back from their first one, just because of the amount of time it takes to process these things. So I think that's something that needs to be addressed going forward. But I'm going to leave the rest of my time here for MP Lawrence. Thank you.
Thank you very much, Mr. Patzer. So we've heard repeatedly that incarceration was never considered as an option. Just wanted to cite paragraph number 43, which caused me a little bit of confusion. It says government authorized hotels had to maintain a secure perimeter, while designated quarantine facilities had to post security officers at hotel entrances and on a floor occupied by quarantining travelers. Why were these? Why was this necessary? Were we protecting these people?
Maybe I'll start and then go to Jennifer. So the designated quarantine facilities are where there are people who are sent if they are either positive or they do not have a reliable quarantine place. So in that situation, we want to make sure that there is no movement of any of the person who is actually sent to DQF outside or inside, and that is something which was a part which we had security parameter built in.
Thank
Jennifer,
you. I'm afraid I'm going to have to stop it there just to kind of keep on track here, but thank you. Turning now to Ms. Yip, and I understand you might be sharing your time as well. I'll let you manage that. Or are you going to start first, Mr. Dong? Please go ahead, 5 minutes.
Thank you very much, Chair. I want to follow up on my previous line of questions, which is to make sure that the public sees the support in perspective. To the Auditor General, I was looking at a chart in the report. There was a finding between February to June 2021, number of missing or unmatched test results in combined of on-arrival and post-arrival, which means everyone has to do on-arrival and post-arrival. The total is almost 400,000. And I divide that by 2 because everyone has to go through 2 tests. That's 200,000 travelers that their test result was unmatched or missing. Out of these number, how many were positive? Did you keep a count of how many were positive from these results?
I'm going to try and answer all those details, and Carol can jump in if I misspoke. I don't think it's a clear analogy that 400,000 tests divided by 2 equal 200,000, because one individual may be missing both tests or only one test. So it could be a slightly different number than 200,000. What we found through the data that we analyzed is that there were 8,000 travelers that had tested positive, and a little over 1,000 of those positive tests where the agency did not contact the traveler to inform them of those results. Carol, did I get that right? She's nodding. There we go.
So the 1,000 travelers out of this almost 400,000 unmatched and missing?
So there were 8,000 travelers who tested positive. Approximately 1,156 had not been contacted about that positive test.
Okay, and that's for the span of 4 months between February and June
of 2021, correct?
Okay, that's good to know, and so that works out to be perhaps maybe my math is stuck now. 1,100 divided by 4, third. Okay, got it. I think the public has the number in terms of how many travelers is entering our country into different communities with a positive result. I turn the rest of my time to Ms. Yip.
Thank you, Mr. Dong. My question is directed to Dr. Koshar. This is in regards to your opening statements. What mitigations or plans has PHAC developed and implemented to identify impacts on border measures on vulnerable groups, such as seniors and those who have medical conditions or challenges?
Sorry, I was trying to get off mute on this one. So our efforts have been very much focused on what do we do in terms of both training our staff to really make sure that they have a clear understanding of who they're dealing with in terms of the population. Specifically, as I mentioned earlier, there is a component of SGBA and making sure that we have a specialized training on that. The other part of it is also focused on making sure that we are clearly making all the attempts to learn from the lessons which we have done in terms of what transpired in the last year and a bit, based on what we've seen in terms of compliance, in terms of the tools, in terms of any other opportunities, and then making sure that we have a clear understanding of what does it mean for those who are vulnerable, those who are of a particular group, and how we can particularly design our programs accordingly.
Additional supports to help seniors who may not have digital literacy?
We're always, very focused on making sure that there is an optionality available. Should there be, for example, as Mr. Chair has mentioned, like we insist that every information be captured in ArriveCAN, and that ArriveCAN would be the tool which is used in terms of making that available. So if the person is unable to use that, so there are options available, whether it is papers or paper submission and others, and that is done at the discretion at the border by CPSA colleagues.
Et merci beaucoup. Thank you very much.
I'm turning now to Ms. Sinclair-Desgagne. 2 minutes and 30 seconds. Thank you, Mr. Chairman. I want to correct a fact so that the Canadians and Quebecers listening to us be aware of this, that the quarantine was enforced in the month of March 2020. However, in October 2020, the cases of flexibility that Dr. Kochar mentioned, that is to say, for cases that were compassionate grounds for people, especially after 10 or 12 days of being isolation, wanting to say goodbye to their nearest and dearest in funerals, it was not even done months later. So we're in a situation where we put policies in place, but the cases of flexibility, special cases, are simply not thought of before these policies are put into effect. So there's a problem there where it's always after the fact that these improvements and corrections will be put into effect. And when I say later, I'm not saying that a day or two after it's put into place. We're talking about months, 4, 5, 6 months after the fact. So I really wanted to insist that in this case, a very specific case, we're talking about people in rural areas or humanitarian or compassionate cases. It was done later, too late in many cases, and there are impacts that will last for a very long time, psychological and physical impacts, and so on. A question, please. Just answer yes or no for Dr. Kochar. Do you believe, following my comments, that there's room for improvement in terms of the implementation of these health guidance measures for the Public Health Agency of Canada? Could I have just a yes or no, please? Is there room for improvement?
Mr. Chair, the answer is very much yes. There's always a room for improvement, and we learn from our lessons as we move forward.
Thank you very much. That is the answer that I was waiting for in good faith. And now just to finish, just a comment. All of the mistakes that were made following the implementation of these measures, we're still not in a position to offer provinces their fair share of transfers for health. And the work of the federal government is not always well done, and I'll wind up on that note. Thank you.
Desjardins, you have the floor for 2.5 minutes. Over to you.
Thank you very much, Mr. Chair. And again, thanks to all the witnesses for being present. I know this is a difficult discussion considering what our countries went through. And to summarize, on behalf of so many Canadians, it's been challenging not just for folks traveling, but for every Canadian, including every member of this committee, and I'm sure everyone at the Public Health Agency of Canada. So thank you for your work. I do want to also commend the Auditor General for this work as well and her office, because of course this is a damning report. It's not good. What we're seeing here, we've seen 2 audits during this period of time, and improvements that are critical to ensure that we have a nationwide process, not only just for tracking and monitoring, but for enforcement. And in order to build confidence on behalf of Canadians in our systems moving forward, could the Auditor General comment on the practices of other jurisdictions, perhaps jurisdictions in similar size, similar scope to Canada, that have done enforcement better, and which jurisdictions those might be?
That's a really difficult question to make that analogy there. Every country is quite unique. We could look to a country that's an island on its own, like Australia, that did really well with enforcement at the beginning, but it's easy to control access. Canada has a very large land border. And so there's so much uniqueness with every country that you need to factor. And you also have to factor in the rate of people being vaccinated. And so it's a nuance, and I caution comparing apples to oranges, but I do caution comparing. I do think it's important to compare to other jurisdictions to inform how to change or improve the border measures that we might use going forward.
Particular to the hotel quarantine system, have other jurisdictions done the hotel quarantine system much better, particularly at enforcement?
I'm not sure that I could answer that. I don't know, Carol, if you have a question, whether you looked at hotel enforcement in other jurisdictions. Can you add to that?
We did look at enforcement in other jurisdictions. Many other countries did require their travelers to quarantine in government-approved hotels, and travelers were generally expected to stay in their rooms at these facilities for the duration of their quarantine. And they were not allowed to be mixing with other guests. And generally, they were required to stay there for the total duration of their quarantine, not just the 3 days, the initial first days after arriving in Canada. And that was unique to the Canadian program. we did look at FAC's requirements, and they did base them on, sorry, there was some feedback there. They did base them on a pilot study that they had done on the incidence of positive tests among air travelers entering Canada. Other countries that we did look at included UK, Australia, New Zealand, Israel, Singapore, and Norway. They did have a greater success in keeping track of their travelers, and that could have been attributed to that the travelers had to stay at the hotels longer.
Thank you very much. I want to thank the witnesses. This was an interesting report. I must say for the Auditor General and her team, I suspect a more difficult report to review, because often the Auditor Generals are charged with ensuring that we receive maximum value for our tax dollars. But of course, in this case, you have the rights of Canadians across the countries to offset that. So on this, I'm going to close by quoting my favorite civil servant, Sir Humphrey Appleby. It's not for me to comment on government policy. You must ask the witness, or pardon me, you must ask the minister. And on that, I think it serves to remind us that I think everyone's done a good job here today answering questions. The auditor as well, assessing the government policies, and if members have had a problem with those policies, of course, the decision is not for this committee, but for the government at large. So thank you very much for appearing today. Our next meeting Thursday will be on Report 14, Regional Relief and Recovery Fund. And with your permission, I look to adjourn the meeting. Thank you.
Thank you.